money on the table. But it's absurd that we operate this way, truly. So next year, there will be a sustainable development goal that essentially will be a health for all goal. This is clear. And essentially will call for universal health coverage. And that means that there must be frontline health workers. And they must use information technology well, because that's the great gift that we have right now. I thought that this was a report, not evidence for having health workers. That we know. No more studies of that. Just study how to get it done. And what we do need is data for health workers, not data for us. We need data in the hands of health workers. So get smartphones well programmed. Ask Ann about 10 countries how ComCare works so effectively. It's beautiful. Every day you see what every worker did, who they visited, what they saw, how many RDTs plus, negative, and so forth. It's a wonderful system. It costs $7 per capita, right? $6 to $7 per capita to implement. So we need to get the no-brainers into the politicians who fit that bill. Which is, you want simple? Here's simple. Straightforward. Everybody gets access to health care, and here's what it costs. And what I beg is, let's use pooled funding, because it's the only way to do this. Please, with AID, with the US government contributions, create a big pool, turn the global fund to fight AIDS, TB, and malaria into a global health fund, so that we have a flexible pooled account that will fund community health workers and other basic primary health system interventions. Let's be honest about the accounts that every country has to be at least $60 per capita public spending for health. Everybody, no matter how poor you are, and if you're rich enough to do it on your own, you better do it on your own, because we can't afford to do it if a country won't do it by itself, if it's rich enough. But that means already being basically middle-income country. The poor countries need help. And so next year, we've got to raise our voice in a very coherent way. That it's not beyond health financing, it is financing primary health. That's what we need to do. Do the arithmetic, get it out there, and take pride in this field. It's the most remarkable field. I'm only envious, you understand. I'm just an economist. So I can do the dollars and cents to get you the money, but you've got to call for the money, and you have to raise your voice. Absolutely, we're going to settle for nothing less than universal health coverage. Thanks very much.